I have a question.
Yeah.
Water. It seems like she is got in her mind that she's not allowed to drink water at all. It has to be
No,
Gatorade.
that's
And how long?
yeah.
does
The
that
water
last?
and Gatorade. I need to do another couple videos on this because people do get unclear about this. Gatorade, I push a lot because, as in your wife's case, she's a little dehydrated, and Gatorade is wonderful at rehydrating. And I tell this story a lot, but Gatorade was actually, before there was Gatorade, there was a tremendous medical problem in the world, gigantic medical problem that killed millions of people, and it's called cholera. In other words, when you drink contaminated water in many third world countries, they get a diarrheal illness called cholera. Okay, and to treat that, they would become so, the diarrhea would be so devastating it would dehydrate them and kill them. So they would treat them, the best treatment was give them IV fluid and resuscitate them, fill them back up until they got over, their body fought off the cholera germ. And that would happen. Okay? But in third world countries, they don't have clean needles, they don't have sterile IV bags and fluids, and so a variety of doctors came up with the idea of just putting back in IV fluid that you can drink. And they found that the sugar, the salt, and potassium could resuscitate these dehydrated cholera victims, and it's been an unbelievable development in world healthcare. This fluid, which is called oral rehydration solution, ORS, is kind of magical. It absolutely changes people's lives. So, our patients are in a kind of a similar situation. That is, they often, because of the surgery, are losing so much fluid that we have to resuscitate them. And we know for a cholera victim, if we gave them water to resuscitate them, they would pass away. They wouldn't live. They need not water, but they need this kind of magical mix that's in Gatorade, which is a little bit of sugar, a little bit of sodium, and a little bit of potassium. And that mix is almost magical or miraculous because it saves the cholera victim, plus it resuscitates our patient's best. But we should kind of think of it like a medicine. It's not to drink every day, all day, constantly for the rest of your life. And it doesn't mean the water is bad for you for the rest of your life. But it means if you're down 13 pounds, that really Gatorade is a foundational medicine for you right now. Now, when you're 9 months out, you can have a little Gatorade if you want, but remember it's got some sugar in it. Water is fine, but remember that you can forget and get dehydrated. So my favorite water Gatorade story is that 6 months out, one of my patients called me and she said, I'm very happy, everything's wonderful, my life has changed, but I have a problem. And I said, okay, what's your problem? She said, well, they won't let me go to jazzercise. And I said, okay, well, why is that? And she said, well, I keep passing out. Okay, so you can see where that'd be a liability issue. So I said, are you drinking? She said, yes, I drink 2 bottles of water.
That's not good.
It's not that water is bad, but she was losing fluid and salt during that exercise time and falling out. And we just switched her to Gatorade and she stopped falling over. So for the rest of your lives, you have to remember that water is fine, it's wonderful, but if you want to have a glass of water, you may want to kind of have a chaser of a cracker. Because actually, a bottle of water and a cracker just about equals Gatorade.
Okay.
You know, I mean, it's close. There's not quite the potassium in it, and it's not exactly right. But you can have anything, but just remember that if you're in trouble, Gatorade, this oral rehydration solution, is the solution for cholera, and it's the solution for my passing out lady in jazzercise. I'll tell you one more story. My other of the passing out stories is one of our patients called to say I had a stroke. And I said, well, I don't think you had a stroke. And she said, oh, yes, I did. And I said, well, tell me about it. She said, well, I was taking care of my mom who was sick in the hospital. And I felt bad about that, of course. And I said, well, on the day you thought you had the stroke, what did you eat for breakfast that day? Because she was about 3 years after our surgery. She said, well, I was busy rushing to the hospital. I was late, so I skipped breakfast. I said, okay. I said, what did you have for lunch? She said, well, I got tied up with taking care of Mom. We were waiting for the doctor, or she was having a test, and I didn't get lunch. And I said, well, you passed out about 3 o'clock. She goes, yeah. And I said, you're in a hospital? She said, yes. So they took you to the ER? She goes, yes. And they did a CAT scan of your brain to look for the stroke? She goes, yes. And I said, they didn't find anything? She said, well, yes, but they said it's a mild stroke. And I said, do you remember the manual? She goes, manual? I said, do you remember salt? She goes, oh. So she had gone the whole day, and understandably, because she had important work, she was trying to care for her mom, who she loved, who was sick and who needed her, but I said, you have to also take care of yourself. This new body is going to have a change in the abnormal hormones that go along with being overweight, and this new body is healthier, but it requires some extra maintenance. And that extra maintenance is hard. So water is fine, but oftentimes you need a little salt to go with it. And you can balance that by just eating a healthy diet. You can get your potassium from fruit, like oranges, bananas, and healthy foods like that. You can get your salt from a salt shaker, and then you can get water. So you kind of mix them all together. You don't have to have Gatorade. But when you're in trouble, wasn't that like a Carole King song? When you need, call on me. Anyway, think of Gatorade.
No problem.
Okay?